we could please bring our workshop to order, please, since it is now 9:30. And, oh, I just got distracted by a note on my desk. I'm sorry. Barry, do you want to kick it off, please?
Sure. Good morning, Commissioners. This morning, we're going to start off with our Resilient Pinellas Action Plan. And Hank's on his way up, and he's going to cover the highlights of this program. I know you've met Jeremy before, but Jeremy, I wanted, if you just stand up, and Jeremy Wall, he is not only the director of our asset management group, he now is the interim director of our utilities department. And so I wanted you to know Jeremy as we go through this transition period. All right. With that, I'll turn it over to Hank.
Good morning.
Morning. Good morning, Madam Chair and Commissioners. As Barry mentioned, my name is Hank Hoddy. I'm the County Sustainability and Resiliency Administrator in the newly created Office of Resilience and Asset Management. I'm here today supported by Jeremy, who Barry just introduced, as well as Katie Shannon with VHB, the consulting group that helped with this plan. I'm here to provide you with an update to our Resilient Pinellas Action Plan, which is similar yet unique to other local communities in our region and around the state. Further, we are very much in tune with the state's Resilient Florida program regarding this plan. So an operating framework has been presented to the board in previous years, and I'm honored now to provide a more thoughtful, structured approach to our work moving forward through the Resilient Pinellas Action Plan, which will encompass our inward and outward initiatives moving forward. In the presented org chart, you will see the intersection of government operations with internal and external committees and the plan itself. On the right, you'll see key components of the plan, which I'll touch on later in the presentation. The following roadmap shows the general timeline to the steps created to create Resilient Pinellas. As you can see, we didn't just make a plan, but this was a huge project conducted over 2.5 years that provides the county with valuable information, data, and deliverables. Overall, the process included extensive research, multifaceted input, perpetual feedback, and due diligence. By documenting existing best practices, evaluating gaps, collecting feedback from county staff, and engaging stakeholders and the public in conversations about sustainability and resiliency, Resilient Pinellas reflects a data-driven, comprehensive, and custom plan to meet the unique needs and wants of Pinellas County. One of the first stops for plan development, as shown before, was the creation of the plan's vision and mission. The formation of these foundational elements in Resilient Pinellas occurred through extensive collaboration with both internal and external stakeholders. We feel that the Resilient Pinellas vision and mission statement both complements existing county priorities, such as the strategic plan, and also sets a tone for positive change and impact for generations to come. On top of the vision and mission statements, we created 5 guiding principles to provide an expression of our values and help to guide plan development. They are being actionable, future-focused, collaborative, data-driven, and community-centered. We then created 4 overarching goals which drive continuity and positive impact moving forward, as well as represent important performance objectives. The plan is further organized by 6 distinct focus areas, which have 18 sub-goals and 56 department-led initiatives, as you can see on the right. The suite of initiatives were refined and ranked through a robust, customized prioritization process. Some of these initiatives build off the work the county is already doing and provide an enhancement, while others are new to the county and fill gaps in our portfolio. When we think and act upon them collectively, we will then embark in a whole community approach, kind of like what's shown on that graphic there, to bettering ourselves and those that we serve. Also, cumulatively, the completion of the initiatives will help to tell a story of aspiration and accomplishment. This slide encompasses major milestones and statistics related to the overall project and plan development, and there are a few I'd like to point out. Starting on the left, we had almost 1,300 voluntary public survey responses, 24 participants on the external advisory committee, 10 external plans reviewed, and a number of other surveys and workshops. Now on the right, on top of what already has been discussed, we've identified over 100 existing best practices, top shocks to the community, including algal blooms and hurricanes, top stresses to the community, including lack of affordable housing and poor water quality, 6 implementation pathways, such as creating departmental work plans and enacting policy, and 6 implementation elements, including the vulnerability assessment work and an external engagement strategy. This slide shows examples of the pages of the plan that's in front of you today. We try to provide the best background of the county we could through topic-based splash pages, and then give context and background to plan development itself. We also dedicated a full page to each initiative, which includes a description, community connection, and then a comparable project-related internal best practice or an external case study. So next steps for the plan, well, we're here today to present it to you and to release it to the public. It's formally on our website. We're going to continue to coordinate with county departments and incorporate initiatives through departmental work plans and budgets. We're going to evaluate cost effectiveness and grant opportunities. I think something that's important to note is that we're going to be working with the departments who are leading these initiatives to make sure that the initiatives are properly executed and funding, and we're going to get as creative as we can to make sure we find grants suitable for these initiatives. We're going to continue to have community engagement activities and refine communication plans, and develop a progress tracking reporting that will be made publicly available. On the right is a pie chart showing all the initiatives that we have tagged with a timeline: short, 1 to 3 years; medium, 4 to 6; or long-term, 7 and beyond. And something to note is that we already have 7 related work plan items for short-term initiatives, so we're already rolling. So in closing, please make sure to check out our project website at resilient.pinellas.gov. We have a full link to the plan there and a PDF version of it, as well as a link to an online story map that shows our highlights. I want to thank you for your time and attention this morning. I await any questions that you have for me. And one thing that I do want to note is that after our discussion today, Sean Sullivan, the Executive Director from the Tampa Bay Regional Planning Council, is going to come up and talk a little bit about the Regional Resilience Summit that was just held, as well as their Regional Resilience Action Plan.
And Commissioners, following the presentation and the work plan, we will be, I also talked to Hank about putting this out on our website because the internal tracking is, a lot of it's done through SharePoint. It's not really accessible to the public to be able to track the measures and stuff. So he'll work on making sure there's a public-facing piece to this.
Absolutely.
Comments, questions, anybody? For Hank? No? Wow. Good job, Hank.
Yeah, it would take us all day to go through this entire document here. So we're putting it out there. If you have questions or things like that, we can bring those up on our one-on-ones. I can bring staff in, we can talk about those or bring it back to a workshop. There's a lot of information here and a lot of programs. So.
And it's a lot of work, I can tell you that, and I appreciate very much your robust attention to the issues.
Thank you very much. And I know that's it's a big, heavy plan. Hopefully you have some time to look at it. It's definitely better than the digital version that we previously shared, and hopefully that will, spark some conversation or discussion. So. All right. Okay. Well, thank you. Appreciate it. Sean, you want to come up?
Good morning, Madam Chair, members of the Commission. My name is Sean Sullivan, the Executive Director of the Tampa Bay Regional Planning Council. I'll give you a brief background on the Regional Planning Council. We are one of 10 RPCs in the state of Florida. We're also the first. We began our 61st year in business earlier this year. Our region is comprised of 6 counties and 21 cities, starting in the north: Citrus, Hernando, Pasco, Pinellas, Hillsborough, and Manatee counties, home to 3.8 million people, 17th largest metropolitan economy in the United States. And if we were our own country, we would have the 55th largest economy in the world at $190 billion. So when I finish that part of my speech, I usually say, so we are a region to be reckoned with. And I think working with Hank and his group here in Pinellas County, and Commissioner Long, long-term member of the council, and Commissioner Flowers, current rep on the Regional Planning Council, your collective leadership as policymakers has really set us on a path, working with Hank and 5 other counties where we have developed a Regional Resiliency Action Plan. And I think Commissioner Flowers may have distributed this earlier in the year to all of you. In November of 2022, this document was adopted by the Regional Planning Council, and it essentially takes a lot of the things that Hank just mentioned and puts them on steroids and provides those as a regional option for cities and counties to opt into. It's completely voluntary. It's really a list of best practices to help us as a region to become more resilient. We talk about transportation. We talk about equity. We talk about food insecurity. We talk about resilient infrastructure, best practices for building and redevelopment. It's really a product of 3 years' worth of effort, and Pinellas County and Hank and your team have really been a leader in helping us develop this document, for which we're very thankful. So at some point, Madam Chair, and there's no pressure today by any means, but I would ask that the Commission take a look at this. We can come back at another time and make a further detailed presentation with our primary author, Kara Serra, who works in our office, for you to ask detailed questions. And if at some point the Commission would be so inclined to adopt this plan, we would be thrilled. I will say Pinellas County has really been a leader in resiliency. And the city of St. Petersburg, really the first local government in the region to take a vote to adopt the Regional Resiliency Action Plan. They did so about a month and a half ago under the leadership of Chair Brandy Gabbard, who was a former chair of the Regional Planning Council. We've really taken this initiative. When we began this in 2017 under Commissioner Long's leadership, it was the 16th initiative of its kind in America. Earlier this month, we held our 3rd annual Regional Resiliency Leadership Summit. Over 400 attendees right here in Clearwater Beach at the Hilton. Many of you were there, and thank you for coming. I know Barry Burton has participated really since day one with our, for the summit itself. And in fact, I remember Barry was newly hired here in Pinellas County, and we invited him to participate in the county administrators panel. And he did. I think he was only here a couple of months. And at the end of that panel, there is no doubt that Barry Burton was the shining star on that panel. So while he was only here for 2 months, his years of experience were very obvious in that panel. We remain grateful for that. Thank you. So I wanted to tell you that the summit was successful. We had private sector, we had public sector, we had many governments. Many of you participated on panels, for which we're grateful. The South Florida Regional Climate Compact has been in business for about a dozen years. And we really learned from them, and Commissioner Long will tell you, we invited those folks over to Tampa Bay to tell us their story back in 2017. And fast forward to 2023, some of the feedback that we got from the summit this year was that our summit here in Tampa Bay was even better than the summits that they've been holding in Southeast Florida. So that was a nice kudo that we were happy to hear about. But we've really structured the summit to be really the target audience are government elected officials, policymakers like yourselves, staff who are in the weeds and do the work to present to you as policymakers. Involved this year, we involved small city mayors, most of whom were from Pinellas County, not exclusively. We did have the mayor of Key West come and tell her resilience story, and quite a story she had to tell. We had scientists come and present scientific evidence on how beach renourishment is critical and how the Gulf changes and how weather patterns change and how we can rebuild to a more resilient way and manner. So it was just really, I think, a well-planned event where we invited folks from New York City to tell about a planning project in New York City. We had a young lady from the Nature Conservancy from the state of Alabama to come and tell about a resilient project that they did in Alabama. We had a young man, and I say young man, he's in his 20s, from Puerto Rico, recently received his master's degree, and he's about to pursue his second master's degree, to come and tell his story, which was a project driven by the public, and had residents help institute a particular policy in Puerto Rico to help really protect the beach, and then to protect, more importantly, to protect homes. And then the last folks we had Parks Department people from the city of Miami to come and tell about a project that they had in the city of Miami. And Commissioner LaValle, we're grateful for you because I know you're a former state representative in 2021 when the Resilient Florida program was created. I can't tell you the impact that that has had, not only in this Regional Planning Council, but really on cities and counties throughout our state. What a score for the state of Florida when that program was developed. So thank you very much for that. We've also been fortunate to work with our friends in the federal government. We worked with the Environmental Protection Agency back in 2016. Commissioner Long, I'm sure you'll recall, We applied for a grant, $300,000 grant from EPA, and that really helped us fund the development of our resilience program and ultimately the Regional Resiliency Action Plan. And we certainly give EPA credit in the prelude, if you will, of that document. We're about to embark on $1 million project with the EPA for the Tampa, St. Pete, Clearwater MSA. Of course, Pinellas County is in that MSA, and it's on the Carbon Pollution Reduction Grant. We will begin to do a greenhouse gas emission study early through the region, and it's a 4-year program, $1 million. It will be the lead agency for, and the carrot and the stick, if you will, is at the end of that planning project in 4 years, there's $4.6 billion worth of competitive funds, federal funds that will be made available throughout the country for implementation of projects to help reduce carbon emissions in cities and counties throughout America. So we're really excited to work with EPA. We also work with the Economic Development Administration. Dr. Johnson will tell you we're an economic development district. We manage a comprehensive economic development strategy. Pinellas County is always a primary player in the development of that strategy, which we update on an annual basis with a comprehensive update every 5 years. So we're happy to work with state government and, most importantly, our local partners as you support what we do. We're thankful and grateful, and I'm happy to answer any questions you may have, Madam Chair.
Thank you. Any questions from my colleagues here? No? Thank you so much,
Thank you.
Sean. I do want to share with you, though, as a result of going down to South Florida to visit their compact down there, I was invited to go to the Netherlands and be a speaker at their World Water Conference. And I was supposed to be there for 3 days, but we ended up staying for the week because they wanted to take us around the Netherlands and show us what can be done if you are really focused on living, working, and playing with the rise and fall of the sea. And the one project that really intrigued me was a project called Make Room for the River, wherein they took an entire city and moved it from one side of the river to the other. And they talked a lot about their research and development, and as you know, the Dutch have been studying this issue for hundreds and hundreds of years, and they've made a lot of mistakes, which they totally acknowledged, but they've learned a lot about how you can build and how you can develop and how you can do it safely and keep your citizens and your environment safe at the same time. So that was incredibly informative and educational. And Sean, if you wouldn't mind sharing with my colleagues how many regional governments we had at our signing ceremony, the original one, and how many do we have now today?
We had 23 original governments join the Regional Resiliency Action Coalition. Today we've got 33 governments. We've actually had governments outside of our region, specifically the city of Sarasota and the county of Sarasota, come to us and say, can we join your initiative? We like what you're doing. And we welcome them with open arms. So it's 33 and growing.
Well, it's a really big deal, and I hope you'll all find time to get, really immersed in the issues and learn about them, because what we learned when we went to visit the United Nations is that Florida is almost a pilot for them in terms of being one of the most vulnerable areas in the entire world to frequency of storms and threats of rainfall, and how heavy the rainfall is now compared to what it was years ago. So there's a lot to be worried and concerned about.
Thank you.
Thank you.
Thank you.
Thank you, Sean. Okay, next we have
The coordinated access model. So I invite Karen to come up and provide an update on where we're at and some of the issues they're dealing with to implement our CAM.
Good morning.
morning.
Karen Yatchum, Human Services Director. And as Barry said, I'm going to give you a high-level update of where we are with the coordinated access model. So as a reminder, the Pinellas County Coordinated Access Model is a client-centered, centralized intake system, which is really intended to streamline access to care for persons who are in need of behavioral health services. The key deliverables are that they are the initial point of contact, they are providing clinical assessment and triage, live scheduling, and then producing data analytics so that we can understand the health of our system. Over the past, I'll say year, we are continually asked, what problem are you chasing? What problem are you trying to solve with the CAM? And really, it is just that. We are trying to reduce the confusion for our residents so that they know where to go, and that it is easy and streamlined for them, and that they are receiving an appointment, not a piece of paper to follow up on. So many of you have seen this slide. This really just indicates our timeline. And so the CAM really has been in the works, I will say, for approximately 3 years. This started in 2019 when we started the process with KPMG and really went on that listening tour with residents, systems, consumers, systems of care that intersect with the behavioral health system, justice, child welfare, hospitals, physicians. And really, again, what we kept hearing was our residents don't know where to go. There was a perceived belief that the only way to receive behavioral health services was through the crisis system. And so KPMG's recommendation was that we build a very innovative coordinated access model to provide that streamlined access to care for our residents. In 2021, we kicked off the project to really build the model. So we procured the services, we wrote the model, we developed the key performance indicators, and then we selected Unite Us and USF. Unite Us is the technology platform, with USF staff being the clinical side, so the counselors, the clinicians that are going to be answering the calls and interacting with our residents. In October of 2022 to current, we have been working on implementation with that team, with the assistance of KPMG. So we are 7 months into implementation, and while that seems like a long time, what I can tell you is that what we are building is new. It is complex. It doesn't exist in Pinellas County. It doesn't exist in Florida, and there are very, very few coordinated access models in the nation. This has taken a significant amount of work from the teams, but we are really trying to build this so that it meets the needs of the residents. Unite Us had a great platform. And what they have traditionally done is connected people to social care by way of referral. And while the platform was the starting point to meet our needs, we weren't purchasing information referral. We were not developing information referral. We were developing appointments. And so we've had to work with them really intensely to really modify the platform. And as you know, that takes time and takes a lot of work. We have also continued in this process to remain collaborative and really sharing of information with our community. So we have hosted community information sessions on the CAM. We have shared information with community meetings. And now this slide's even outdated. We have had over 40 provider engagement meetings, really with community providers, one-on-one with their teams, talking about the CAM, developing workflows with them, understanding their book of business, understanding who they can and can't serve. And really in the process, the goal was to work with them to have appointments set aside for residents who are contacting the CAM. Building the CAM has really focused on 3 areas, so access, communication, and technology. And with access, our goal really was to have multiple access points for residents. So 1-800 numbers, texting, web, online chat, really to make sure that we could meet the needs when someone was ready to access care. We've worked on clearly defining pathways for services, really aimed again at reducing confusion for residents. Worked at providing choice on type of appointment, location, provider preference, and then working on standardizing the tools so that when someone contacts the CAM, they are receiving evidence-based screening and assessment, and then a level of care assessment that will link them to the right service the first time. We've worked on communication, so ensuring that we have a live answer and that CAM staff are highly trained, kind, supportive, trauma-informed, and knowledgeable about resources in the community. We've worked on a marketing and communication plan, ensuring that we are able to target residents who are in need, but also services and systems that work with our residents who are in need of behavioral health care. We've also continued to work on technology, so ensuring that we have e-referrals. So if someone wants to go on the website, they can create a self-referral for CAM staff to reach out to them. And then also working so that providers can complete referrals on behalf of their clients to receive behavioral health services. We've worked on automated appointment notifications and reminders, and then again, working on a shared platform so that multiple service providers working with the same client can receive the clinical information that the CAM staff are completing. So now I'd like to walk you, oh, sure.
Karen, hold on one second, please.
Yeah, just
Commissioner
a
Eggers
question,
has
please. In the beginning, you talked about the key deliverables, one of them being clinical assessment and triage. And if you go back to that previous slide, and I was trying to figure out where in this system of the key elements, where are we introducing that piece in the communications arena? How are we actually triaging somebody's situation when they call in, as opposed to just connecting them to a service? How does that work?
So I'm going to touch on that, but when someone calls in, we have trained clinicians who are going to be doing a multitude of screenings. So they're going to be screening for depression, anxiety, substance use, suicide risk, and anxiety, mood disorders, and then determining, is this caller appropriate for which level of care that's available in our community, and then also working with them to determine, are they currently in crisis? So we're not building this to be a crisis response model, but we are building it to ensure that we can link them appropriately. So it's going to be a multitude of screenings that are documented and then shared with the receiving provider.
I'll try to be more patient.
That's okay. Okay. So this is kind of the ideal state. So this is the goal that we are working towards. And I'm just going to walk you through this. So Tom is our resident. He calls the CAM, and Sue, who is the CAM staff, answers the phone. Tom contacts the CAM, Sue completes the assessments that we talked about, and then she schedules the appointment with the provider. And then she sends the appointment confirmation to Tom and the provider, as well as the clinical documentation, so that the provider isn't starting from scratch. They have all of the clinical documentation that was completed during the CAM process. Lily, who is on the provider end, is notified of the appointment, accepts the appointment in the system, reviews the screening information, provides services to Tom, and then circles back to the CAM staff. So the CAM staff know that Tom attended his appointment, that the provider received the clinical documentation, and so that's that closed loop process that we've talked about. The collaboration is that all of the CAM providers who are serving Tom with the appropriate releases have access to that screening and clinical documentation information. Sometimes our residents need more than one service, and so this is going to be a resource for other providers who are serving Tom. And then lastly, really all of that information will then push towards data analytics. So we'll be able to see answer time, screening time, appointment wait time, and then if there are concerns that Tom needed a level of care that wasn't available in our community, we will know that as well. And that really was kind of the driving force towards the coordinated access model, to provide us the data to determine if there are gaps in services in our community, if there are service needs that our residents need that we currently don't fund or aren't available. And then that information then is presented to PICA, so the Pinellas Integrated Care Alliance, which is the Sheriff's Office, Central Florida Behavioral Health Network, the county, the Juvenile Welfare Board, and the Florida Department of Health, so that as funders, we can make decisions on possibly new funding, shifting funding, or possibly looking at federal or state grants to meet the needs of the residents. So the project implementation, we've been working towards the MVP, the minimum viable product that we collectively, between the 4 entities, agree that we need to be able to start testing with residents, really with the goal of working towards go live. And so what we have completed thus far is that we have hired highly skilled and trained clinicians. I can attest that I will say the CAM manager, he cares about residents. He came from a program in Pinellas County where his role was really navigating and linking residents to services. And when this opportunity became available, it really closely aligned with what he really feels the greatest need in our community is, which is connecting individuals to services. We have selected screening tools and assessments that meet the needs for both mental health and addiction. We have implemented a sophisticated phone system that allows for warm handoffs, quality assurance reviews, and interactive messaging. We have implemented a language line to ensure we can communicate with residents who are non-English speaking. We have continued to work on building out the technology with Unite Us to make sure that it's meeting the needs for the program. We have initiated plans for individuals who are in crisis and reach our CAM staff. And really, we have 3 options at this moment. So we have worked where we can dispatch the mobile crisis response team, so clinicians can be sent out to the resident's home or interact with them via telehealth to ensure that they are not at risk. And if they are at risk, they can appropriately take them to the crisis receiving facility or provide on-site services. We can also dispatch the Pinellas County Sheriff's Office mobile mental health unit. So again, the trained clinician and trained officer to go out and respond. And then if needed, we also can transfer to 911. We have also worked to secure supportive services. So in addition to behavioral health appointments, we can link individuals to peer services, services at Vincent House, substance use services at Gulf Coast Jewish and Family Services, as well as NAMI for supportive groups for individuals or family members who have loved ones with behavioral health concerns. I'm happy to say that we have, again, this slide, I could update this every day, but we have secured 35 appointments to date every single week for our residents. So we have providers that have agreed to hold appointments for us so that we can streamline access. And we were originally, I would say our target was 25, and we've surpassed that with 35 every single week. So where are we with testing? And so what I can say is that we met with the sheriff, and we were updating him on the coordinated access model. And he's been a really great partner. He really believes in this. And he has agreed that when we are ready to test, that the mobile, the Pinellas County Sheriff's Office mental health unit can be our first test. And so we have developed training information. We've met with the team. And when they are interacting with individuals, so not the highest utilizers, because again, this is really aimed at kind of the first call, they will provide the CAM information to that family member, to that individual that's in need, and they will facilitate that call. So they may be able to call with them, they may be able to sit with them and do that, or the civilian on that team may be able to do that, or they will leave the card for them to call. And we really challenged him. We said, test it, break it, give us feedback. We really want to know in this kind of controlled environment how it's working. And so that is our plan, and that is also where he agreed to say, if the mental health unit is referring individuals that they believe need a mental health service, if it's appropriate and they don't attend their appointment, we would be able to send the mental health unit back out to determine why did they not attend their appointment. So again, kind of to close the loop. And that wouldn't be for every case, because not every case, would require the sheriff's office and the mental health unit to go back out. But for those that they are concerned with, or those that the CAM staff are concerned with based on what is occurring during the screenings, they'll have that ability to send that team back out. So our testing phase, once we go live, we are going to initiate with KPMG and our partners the continuous quality improvement process of Plan, Do, Study, Act. And so once we are going live, we will be meeting multiple times each week to look at our performance, look at data, look at trends, look at answer rates, look at the notes. And really, that is a rapid cycle process where we can make changes, we can implement new strategies, before we really go live for the public. And so that will really be occurring all throughout, but it will be really, really intensely occurring during that testing phase with the mental health unit. I'm sure you're thinking when. We've said spring of this year, when is this going to go live? And what I can tell you is, I will say last week, internally, the human services staff, as well as the communications team, we tested the model. and we did not feel like it was ready. We're not looking for perfection, I would say, right out of the gate, but we want it to be close. You know, we're looking for probably 90% when we're going to be engaging our residents in a clinical behavioral health service. So we are continuing to work with KPMG. They have come on site. They are going through the process live with UIS and USF, and they're also bringing in 2 additional technology staff to really dig into the technology to make sure that it's working smoothly, to make sure that there are no holes. And so we're going to continue to review that over the next few weeks. And then we will be initiating that testing phase with the mental health unit, and then ultimately going live with the general public. I wanted to make sure I didn't leave you with these 2 things. So we've built the website, and I will just say publicly, I cannot thank Barbara and her team enough. The goal of this, and this is, you know, no disrespect, we did not want it to look like a government website. We didn't want it to look like a technology platform website, and we didn't want it to look like a university website. We wanted it to look professional and calming and inviting. And so this is kind of the landing page that our residents will see when they go on the website. And I think that this tagline really answers that question about what are we chasing, what problem are we trying to solve, and we are trying to make it easier for residents to find mental health and substance use services in Pinellas County. And lastly, again, with the help of our communications team, we really thought long and hard about the brand. You know, we've used CAM now for 3 years, and so we didn't want to have a shift with the public and with our residents by introducing a new acronym. As you know, human services and this social work field, we always love acronyms. So we worked really hard on what would work with CAM so that we could continue to call it the CAM and then we didn't lose that identity. And so we had multiple meetings, multiple different brands. And I will say, when we met with our team on the Pinellas Matters project, so again, that's the substance use services at Bayfront with peers, one of the things that the project manager said to us, to Lourdes and I, was that when she interacted with a young client, she kept saying they cared about me. Like, she couldn't believe that someone cared about her receiving that service at the hospital, and it really just clicked, and it was just the perfect timing. And so this brand was developed with the team, again, under Barbara's leadership, and we really think it says everything that we're trying to accomplish, and that we care about our residents, we want them to feel cared for, and we want them to be connected to the right services. Thank you.
Commissioner Flowers?
Thank you, Madam Chair. Excellent presentation. And a long way from when this was just a discussion. I know at one point we had a conversation about the assessment tools that would be utilized so they would look uniform across. So my question is, were we able to accomplish that, or are we going to be able to accomplish that? And does it align such that those organizations who have to report also to their other funders, does it align with that so that they're not having to do double work? Because I know sometimes when we do initiatives, you have to do this one document because it fits this screen, but then you got to do something else, and I would hope that we don't have to put additional work on some of those partners that we have with the CAM.
Yeah, I'll say that is still a work in progress. So we are really working with our providers. Our goal was not to take billable work away from them. And so, you know, many of them do screening and assessments and a full biopsychosocial, and they bill for those services to various funders. And so what we looked at from the clinical perspective was, what could we do that would help inform that we're matching the client to the right provider, and that we are sending over the documentation to aid in their assessment. And so many of the tools are similar. So the depression screening, many of our providers use that. And many of you may even be asked that at your primary care office. It's, you know, a PHQ-2, but we're gonna be using a longer one. But it's okay if we ask that again, because they are point in time assessments. So how you're feeling today, it may change in 30 days. But it's all going to be informed. So our goal really was that the clinical providers could review that information, to help inform their full biopsychosocial.
And my last question is, once this goes live for the general public, the data that will be collected, that is data that those other partnering institutions can have access to for their report out measures, because even though they're working with this special group, they still should be able to hopefully use these numbers when they're reporting to their other partners or funders for services. Or is this just data that will be collected and can solely be utilized for this purpose?
So the CAM data should inform kind of next steps for programs. So identifying gaps and identifying needs in the community. I do think that the data will be helpful for providers who are also writing for grants, because they will be able to really show this is the wait time, or this is the gap, and this is what's needed, and we'll have evidence for that. I think with the other initiative, so the optimal data set, that is our goal, to help reduce the amount of reporting that some of the providers are doing collectively with funders. And there's still a lot of work being done in that space as well. Sure. Thank you.
Anyone else? Questions? Commissioner Eggers?
Karen, as usual, thank you. Appreciate your thoroughness on this, and I'm, continue to be educated every time I have a presentation like this, or every time I sit down with you and talk about the things that you're working on and what we're hoping to accomplish. So, again, I just wanted to go back to the beginning where we're doing the initial screening, and I just want to make sure I understand what in addition to trying to find a service for them, what is our value added that we're providing that caller at that time? What are we doing with them as they call in? Other than trying to assess, I'm assuming, but could you maybe speak to that?
So I think the value add goes back to probably what we heard from some of the residents when we spoke to them. So they don't know where to go. They don't know where to start. Sometimes finding providers that accept their insurance is challenging, and so that's the value add. So when they call in, we're collecting insurance information, and that's part of the match. So we would know if they have insurance type A, that we are matching them with a provider who accepts insurance type A, and that they are eligible for the services that are going to be provided. So I think it's reducing some of the front work, it's reducing some of that confusion, and really probably providing a very comfortable space for them to have a conversation from their living room versus going to possibly a building and sitting in a waiting room and having that initial interaction in that space.
So what are the people's credentials and background that will be having that conversation with them?
So we have the CAM manager is a licensed clinician, and he oversees the team. Most of the staff are master's prepared clinicians with significant experience. And really our goal was that we are looking for highly trained, skilled staff. So this is not meant to have like a new graduate be the employee. We may have some interning and shadowing opportunities because that's really common in the clinical space, but it's really skilled staff is who's going to be receiving the calls.
Okay. And you made a comment about we're kind of anticipating this being a first call, but because of the industry and the things you read about it and the level of service that they are getting or not getting, or the frustrations that they're feeling, this could be somebody that's mired in the system that just needs like a way out of that mire. So how are we encouraging people to just take stock of where they are, and maybe there's another path if you're not, getting what you need taken care of?
Let me, Commissioner, I think I've watched this program develop and what they've done with this over the last 3 years. In my own experience dealing with a family member in a different area, they don't know where to go. But the only services, if you don't know where to go, is to the hospital, especially on a weekend. And there, the only really referral system they have is to put you into a locked facility. Well, if you go into a locked facility and you don't need that level of care, you're not going to call the next time. And so getting the right level of care and that assessment up front is going to be huge to help them even not fear the system. And my own experience in trying to help them, and they have like a 2-on-1 system. And frankly, it was worthless because it's not accessible on the weekend, you know? And you call and you get put and you leave a message and they'll call you back in 5 days or, you know, whatever. Well, you know, so them being able to do that assessment and help them navigate that system in your worst, most vulnerable point in your life, I think is going to be huge for our residents.
So it's not just going to be the insurance part that we're talking about, but trying to match them with the service that they feel best fits.
Yes, and that's why it's really skilled clinicians that are doing those assessments and then understanding what services that each of the different providers offer to make sure that they're matching them appropriately.
And then my last question is, with HIPAA laws the way they are, and they enter into the system as a potential patient, and we're following up to make sure that the care is being taken. If they go between different doctors to try to find the right person, maybe they didn't get the right person the first time, are all the notes that are being collected along the way for that particular person accessible to all the members that are treating that person? Or is it do they have to kind of go through that? I'm okay sharing that information. I'm thinking of like the Baycare system. When I go to a doctor, I go to another doctor, they have the information from the first doctor in the system already. How is that working?
So that they will sign a release up front, or we will have business associate agreements with the Untitled platform or USF so that information can be shared. And that's still some of what needs to be really solid before we hit go with our consumers. The call information will be stored. So if you called the CAM and you had an assessment, that clinical documentation will be stored. If you call a month from now, that will still be there. So the CAM staff will know that they linked you with provider A, and that information will be there. But the ongoing treatment will not. So this is not a collaborative kind of electronic health record for all, because all of the providers have their own. But the initial appointment and clinical documentation will be there and can be shared if the appropriate legal releases are in place.
Okay, thank you.
So, Karen, how many providers are you working with? No?
The number, let me see. I mean, I would say at least 20. So we're working with both our contracted providers as well as new providers. So newer that we currently at the county or maybe Central Florida do not currently work with. So some are in Pinellas County, some are statewide because they provide telehealth. So I will say that that's probably a pretty exciting thing with the increased capacity that we have with the 35 appointments, that it's a blend of some of our traditional contracted providers, but some not.
So, in the collection of the data, is it collected similarly to electronic medical records? And if so, where is the data stored?
So the data is stored in the Unite Us platform. And so,
In the
yeah,
what?
in the Unite Us platform. So when someone calls in, they'll be collecting all of the information, their demographic information, their insurance information, and then the screenings are also in the platform, which will be stored.
And so how susceptible is that to anybody and everybody having access to it?
No, Unite Us has a really secure platform, lots of security controls, and so that's some of the work that we're also doing. But they are high trust, 42 CFR certified, HIPAA certified, high tech. That was all part of their presentation when they bid.
That's good. Thank you. Anyone else? Commissioner Scott?
Thank you, Madam Chair. I appreciate that very much, Karen. I think this is super exciting. I can't wait until it's ready to go live. Do you have any gaps in coverage right now between providers? I mean, are you looking for ones you can't find, or how's that?
Yes, that's an ongoing, it's an ongoing process.
Well, and also, Commissioner, this doesn't solve the issue of not having enough mental health appointments. You know, there's still a gap in the capacity. So we're trying to fit in this within a system that has challenges meeting all of the need.
Yeah, some of the feedback that we continue to hear is the staffing shortages in this space. So a lot of clinicians have left this space, and so providers have vacancies, and they are still working to hire. And many of them are saying they have enough patients, that they don't need another kind of funnel of patients to them because they're full. And so I think that's been the exciting part of having new providers come in and say, we absolutely can take 10 appointments a week, 5 appointments a week, because our hope is 35 is enough, but we don't know. I mean, 35 a week may not be enough.
Okay, thanks.
Anything else?
I just got,
Commissioner Peters?
yeah, and we have been disappointed in some of our local providers not wanting to participate. So,
Well, is it because they're full already?
I can't answer that question.
Okay, just curious. All right. Thank you so much, Karen. Great presentation. All right, now we are on to One Pinellas Business Alliance. Barry?
Yes, Commissioner, so Cynthia Johnson, Dr. Cynthia Johnson's on her way up. We're going to launch, and I've talked to you this individually with you, but now we're ready to relaunch a new look at the way we do economic development
Yay.
in Pinellas County. This not only will, I think, improve the way we do business here, but link us to a larger regional effort, and I'm not going to steal her thunder and let her go through this, but we've been working on this hard. There's been lots of input from mayors, city managers, private business at all levels, chambers of commerce. They've all been involved in coming up with what our future vision looks like. So we started from scratch, and we tore it apart, and we built something that we believe will take us into the future. So with
Good
that, I'll
morning.
turn it over to Cynthia.
Good morning, Cynthia Johnson, Economic Development. This morning, I just briefly wanted to share with you some updates about the Industry Council. As Kevin and I have also discussed with you individually, that we plan to launch a new CEO group called the One Pinellas Business Alliance. The alliance will place the existing Industry Council, and as Barry stated, this is the result of many stakeholder engagement sessions and participation with our legal team to review the content. So the new council in its new structure will be a group of CEOs and industry representatives. These representatives will be a fact-finding committee. They also will be offering insight that is pertinent to our economic development strategies from the perspective of their position as industry leaders or stakeholders in the community. Next, we will have a maximum of 35 members, and the county administrator will have the ability to invite the participants to be part of this business alliance. With that, we are changing the format to have quarterly meetings that are really issues-driven, solutions-driven. We want them to be engaged in these meetings and not just have coffee settings where we have coffee with each other. We really will be talking about discussions on real live issues that impact the countywide economy. And then lastly, we'll have an annual summit as part of the new structure.
Let me just add to what she was talking about. It was very, very important that, we've had different versions of the Industry Council over the years. You come, you have breakfast, and you walk around, you're doing information sharing. We don't talk about what's driving workforce issues, what's driving regulatory issues, what's driving business decisions. It's, it's not as productive as it needs to be. And that's the reason we really want to get a council where we're going to get in and actually talk about what are the drivers of economic development decisions. How can we frame ourselves to help businesses make those decisions, or link them to where they're more competitive in this environment. And so we need We need C-level suite people. We need people that can really give us that true feedback on what are the drivers that we can do, what are the things that we can impact to help that environment. And that's, I think, the difference from some of the past industry councils and the way we're doing that. The reason for the appointment is we want to have real discussions and the folks, their direct conversation with the private folks is that means they want a roundtable discussion, and that is not public, okay? And the reason for that is to be able to just have input to the economic development staff on those things that they feel are important drivers in that. That was the reason for that structure, and that came directly from the private industry people that were looking at that. What this will also do, though, is set us up, I think, in a better forum for talking about regional issues. If we had, for instance, our regional, alliance before, who represents us from, municipalities and stuff? We think St. Pete, but you have St. Pete, you have Pinellas Park, and you have Oldsmar, and very different type of industries and things that they represent. And so by having this forum, now you've got a centralized place for everybody to be represented, both from an industry standpoint, from a government standpoint, to really talk about the drivers of that economic development. I'll tell you, one of them is to make sure CareerSource, Steve or somebody from that staff, is an integral part of that. I think there's a lot more we can do with workforce issues in this alignment. But that's the reason it's very, very strategic in and getting the right mix of people to have those discussions. We don't want to, if we just come in and we share, we should go around a round table, people don't want to participate because they're not adding any value to that. If we can get it to where it's a packed agenda, but it's very strategic and it's quarterly, probably more often in the beginning, but get to a quarterly meeting, then they're willing to make that investment in time because there's something to give back in driving regional economic development. That was the discussion that we heard. And I wanted to give you some context to that because there was several direct meetings and we went around and talked about different structures, different formats, and things like that.
Thanks, Barry. And in those discussions, some other key points was the fact that, we have to have representatives of our business community at the C-suite level, even in our small business, to participate as well. And I know that is a question that I got. And we really want to be able to respond to industry need countywide, and so all that we serve. So some of our very key next steps, we are currently working with legal, and legal is in the process of finalizing a resolution that reflects the changes, and our goal is to bring this back to you, the ordinance and the resolution, for your action in June. The One Pinellas Business Alliance will identify and notify member candidates. The process moving forward will process the application and provide them to the county administrator so that he can invite these members to participate. So kicking off this new structure, we plan to do that at the Fall CEO Summit. And the CEO Summit is something that really birthed out of industry desires. They want to have an opportunity at the C-suite level to meet with our CEO and our city CEOs, if you will, to really have some authentic discussion and just get to know who's in the room. Barry had a meeting with the regional county, and all of you had a meeting with the regional commissions, and some didn't know others, but just to have that one opportunity to really get to know who's in your community. And so lastly, as part of this industry insight that we will glean from these CEOs, we will use that information to help inform our strategic direction for economic development, in which you all will be a part of as well. And so we have partnered with Fort Pinellas, and we've been working with WIT on the TIL study. So the TIL study for us will really talk to our core outcomes and the direction we're going in economic development. And so some of the core missions that we want to make sure that we incorporate into these discussions is maintaining and expanding our targeted employment centers, as well as identifying the most relevant and thriving target industries that we have here in the county, and of course, modernizing our facilities for not only today's use, but future use. And if I could just take a point of privilege and just add that the citizens of Pinellas County felt it worthy to add the penny for Pinellas and allow economic development and housing to have a portion of that. And just at the Tampa Bay Regional Planning Council's annual resiliency conference, the Employment Sites Program, which is designed to modernize and expand the infrastructure for investment in our community, did receive an award for the good work that is being done through that program. And I just wanted to share with you all as a little sidebar that we have just hit the $1 million square footage point of new improved infrastructure in the community with the Employment Sites Program. And that really is exciting for us. And so as we do those type of intentional initiatives in economic development, we continue to fold in the good research and the good background that we have received through the TIL study. So that's all that I really have to share this morning. But our friends Whit is here with Fort Pinellas and is going to come and give you a nice overview of what the TIL study is and how it helps inform economic development. So at this time, I'll take any questions.
Dr. Johnson, hold on one second, please. Commissioner Latvala and then Commissioner Flowers.
No, I didn't. Go ahead, first and second, I'll go third.
Thank you, Madam Chair. On the 35-member board, is it going to be set up where a certain number of slots are for people or for CEOs that have like 50 and under employees?
Yes.
Certain number of slots for like 500 and under?
We really want it to be, I don't think we're going to get the CEO of Raymond James, nor do I think we really need them there, but different types of smaller employers, larger employers, manufacturing, financial services. We want to get a mix of professionals. First, we got to see who is interested in doing it, but two, we really want to have that mix, because the piece here about the strategic planning process, the last thing, we want to launch a strategic planning process around a SES, which is a comprehensive economic development strategy, and that really breaks down your critical skills shortages, which goes to career source and the reason they'll need to be part of that, and all the business drivers. And we want staff to every meeting start with where are we at and where we've progressed. We want to use that as a blueprint to where we can show where we're at, what we're doing, and whether it's making an impact. So we're accountable for results that are from that study. But we want that council to inform us in creating that strategic plan. But yes, the idea is to have a balance of different types of memberships.
So do you have more, Commissioner? No?
No, ma'am, I'm good. Thank you.
You're welcome. Commissioner Flowers?
Thank you, Madam Chair. Thank you for the presentation. And I think it's always good to have decision makers in the room, because when you have persons who have to go back and ask, that just kind of makes for another layer. Commissioner Latvala did kind of hone in on one thing that I wanted to focus on, but I also would like to make sure that when those meetings are occurring, it's not just about what they think that the industry is doing or the direction, but what's the direction that the county, our strategic plan and what we've already put in place and where we're going, even with resiliency, and how does that fold into what they're doing within their organizations, and how does that catapult into potential job opportunities or job growth, or if they're building a new building, looking at LEED standards or whatever. So really a two-way process.
And Commissioner, I will share with you that that is definitely one of the goals of the new alliance. And the new alliance is, this is going to be a partnership. That's why we are saying engagement sessions. We want them to engage. We want to be able to share with them where we're going and what's our perspective of the county. And then we want to receive what what industry is happening so that we can work together, because as reflective in the name, this is one community, one Pinellas, and we're all in here together. So all of your comments are very well received, and it is the goal of the Alliance to be very intentional and inclusive in that fashion.
Thank you. And the, only because you just mentioned it briefly, I wouldn't rule out Raymond James. Raymond James sends their CEO to our Education Foundation meetings. You know, they like to be involved. So I know you just use that as an example, but I'm just saying because they are a larger employer in the area of finance and a number of other areas. But I do see this as a positive opportunity. I am excited that it will be that two-way communication and that it's being described as a way to help inform our strategic planning process. So to garner information, to fold that in as it relates to what we will look like in the future, you know, 2025 or you know, beyond that and where we're going. I think that'll also help us when we are, not just with CareerSource, because we had a long, lengthy meeting yesterday, CareerSource. We had a long, lengthy meeting yesterday. But I also think that it will aid in even where our educational system, Pinellas County Schools and whatnot, the focus that they are going in and what they're doing with technical trades and all of that in preparation for students to graduate and where they fit into the scheme of things for the economy and for job opportunities. So, thank you.
Thank you, Commissioner.
Commissioner Eggers.
Yeah, thank you for your thoughts this morning. It was interesting getting their feedback, all of their feedback about the type of organization and the adjustment that the one thing is keep the politicians out of it so we can talk strategy and really, I think it's great. I mean, I think it's awesome that they have that opportunity to talk candidly and in a maybe quiet environment that's not so politically accessible, because they can certainly do that at any time and contact us directly. So
Correct.
I'm glad to hear that. I think, to your point, I think it was great to bring up the idea that we have a mixed group of people that can engage. I'm not sure every meeting that we would have in my mind would interest all 35 people the same level. So to some degree, to your point, Commissioner Flowers, about informing them on things that are relevant to their business that we're doing, I think capture them. Because a lot of the things that really drive businesses in terms of interaction is over restrictions by government. That gets them going quicker than anything, right? So what are the things that are positively will get them going? And I think understanding what we're trying to do from a infrastructure perspective, I think is good, because that does affect their business in some way. Right. Engaging them on how we're reaching out regionally to bring other companies in here or help with the employment, working with the universities to train people up, because that's a big issue for them. It's going to be really important that we make those topics value added to them. I mean, otherwise we won't get them to engage or look forward to that next meeting and say, well, it's only quarterly, but you know, the last one was really good. They had some good, you know, good presentations or good discussion, good interaction. So
It's going to be very important that we have meaningful dialogue and there's, you know, strategic discussion.
Yeah.
If you have a monthly meeting, well, and you have 35 people, and these are busy executives.
Yeah.
You know, it's easy for you, you just have to miss. Well, then, you know, if you end up with, you know, 18 members, well, then you've changed the dynamic of the discussion because half the people are not there. And that's the reason it's real important to make those touch points very informative. They get an advance packet just like you do. Yep. They've got, you know, read-aheads to where when you come, everybody's prepared to have that type of engagement. And so it's incumbent upon staff to make that a meaningful discussion and, you know, and really have high-touch, high-value type issues. So that is the absolute goal. We want to recognize and respect their time and their input.
Yeah, I do know that, you know, a lot of these groups, the companies out there, they have informal gatherings of executives in their industry. And the only reason they attend them is because it's relevant to them, whatever that industry issue is, right?
Right.
So that's why, you know, getting a list of priorities from them about the kinds of things they would like to hear about as it relates to our understanding of what Tallahassee's doing on certain key issues, or our understanding on what we're working on in these different arenas that might have value to them, to let them know what we can do, but also to really find out from them, prioritizing a list of things that they want us to engage in, and make it really productive for them, and productive in turn for us and our residents and that kind of thing. So anyway, thank you. Appreciate the update.
So I just want to say, I have full faith and confidence between you, Barry, and Dr. Johnson that we can pull this off and get the head of Raymond James. And I think if you go into it saying, well, I don't think we're going to get the head of Raymond James, that is a negative Nelly
I was being
attitude.
facetious.
Shame on you. But
They're on our list.
yeah, because I saw how having the top guns from some of the biggest industries, when we did the global Tampa Bay thing, that was fabulous, listening to that guy from Virgin Air and the woman from JP Morgan Chase. So,
My comment was, and I was being facetious, but my comment was really to find the right level of person that can give us value as to the drivers of the local economic issues. And a national corporation may be so, up here that the workforce issues and business drivers at a local level, there may be it may be that person, it may be somebody different. We just want the person that can most impact these discussions. And, Jabil and Raymond James are absolutely important employers, and we'd love to have them.
Apology.
I mean,
I can
there's
come
many,
up
many
with a
more.
list in my
So,
head of people that are
Sure.
very significant. And I want to make sure that this plan, I'm assuming, is for Pinellas County,
Absolutely.
right?
Yes.
Good.
Yes, this is our countywide initiative that will influence what's happening in the region. Because, of course, they come to Pinellas County Economic Development to really look at the regional scope, what's happening in our region. And so what this does is gives us a single point of information sharing where we can then share the perspective of Pinellas County with our regional partners as we work on regional initiatives as well.
So if you wouldn't mind, Dr. Johnson, I have a story I want to share with you that happened just this morning that I think would be very relevant to this conversation. I don't want to bore everyone with my story, but
Okay.
you'll find it interesting, I'm sure. Yes.
To the point that you brought up, what might be of interest to the Raymond James Chief Executive Officer is that he's in the room with other chief executive officers of other major companies, and that audience might be of real interest to him as well, whether it's direct or indirect, in terms of what his company might do for them or what they might be doing for his company. So it may not come out the same way. What really is of benefit to them might be different than what's benefit to that CEO of a 35-person size company, but they all have similar issues. They're just at different levels.
And my own past experience in working on an organization like this is, we may get a mix, and I think we're going to have to work on what that ends up being, and we're going to have continuing discussion as we grow into this. But we've also talked about an annual summit where we bring the CEOs and we make it a big deal for them to come together and kind of a report out. And that may be where somebody that may want to send a staff person, a still C-level suite, but then we make it a big deal for an annual event and then really pull the region together. And then that's kind of a report out. What have we accomplished? So we're going to have to play with how it ends up being, but I think this is a good start, and I think we're hearing a lot of positive feedback. We're having a lot of positive feedback from our municipalities about the work Dr. Johnson's doing and working with them on local issues over the past couple of years. So, it's all linking together. This is a place to centralize that and kind of have a fresh start with the way we do economic development here in the county.
Recovering from this cold, and because there's some little issue in Oldsmar that I wanted to hear about at the commission meeting, and then I see this Dr. Johnson giving a presentation to the commission there on a number of issues and a number of initiatives, and there was really good engagement. So taking it on the road at 7 o'clock at night to a commission meeting to let them know kind of what we're doing. And you have your folks, really good folks, that go there to their chamber, if you will, monthly, weekly, depending on the need. So there's a lot of connections that are being made with our chambers and in our cities, so I really appreciate that effort. I just wanted to make sure that you heard that from me, so thank you.
Thank you. Thank you, Commissioner. What?
List up is Whit Blanton, Director of Ford Pinellas, talking about the target employees and industrial land study update.
Good morning, Madam Chair, Commissioners. Pleased to be here. I wanted to just give you a high-level overview of the target employment industrial land study that we've been working on for the last couple of years, and also acknowledge Jared Austin of our staff, who's been the project manager for this effort. And Jared just got his 5-year employment and just passed the American Institute of Certified Planners exam, too. So, and he'll have to answer any detailed questions you might want to get into. Just a big picture overview of this important study is we've really tried to look at what's the best land use policy and set of strategies that complement each other to continue to support economic development, economic growth, economic opportunity in Pinellas County. And we have a lot of competing demands for land. Many of you are at the Homes for Pinellas Affordable Housing Summit back on April 28th. And we've had state legislation over the last several years that essentially preempted our ability to preserve industrial employment lands to enable affordable housing to be built in commercial and industrial areas. So we've had this really difficult series of crises and competition for limited space. And we wanted to figure out what's the best way to address that challenge. Just a little historical footnote is going back to 2008, we had Pinellas by Design, which was a countywide effort to look at our target industries and set a policy context to preserve our industrial land. And at that time, counties all over Florida were wrestling with rapid growth, rapid change, and a loss of industrial land. I did a lot of work in Manatee County and Sarasota County, and they lost a lot of industrial lands to growth in that era. And Pinellas, I think, did a pretty good job of preserving that higher wage employment. And we're talking about export-oriented industries that bring income into the county from outside sources, the base economy, essentially. And in 2008, we created Target Employment Center overlay districts, which essentially tried to preserve, pretty much in amber, these industrial lands, because we were told at the time we needed 500 additional acres to preserve our employment base. And where are we going to find 500 more acres of industrial land? So we really had to cling to it as tightly as we could. And that preservation-based approach has been policy for 15 years. This chart gives you a little historical context of the employment trends, and you can see the dip around the Great Recession just after that. Job growth hasn't been achieved in terms of what the 2008 study identified, but what we did see in terms of the comeback after the recession was that office and industrial jobs outpaced all the other employment categories. That's the blue and the purple in the chart, and have performed really well in terms of that comeback. These are the target industries, and it's a little hard to read on the slide, so I hope you're looking at your own materials on this, but the items on the left, the 4 categories of business services through marketing, are all Class A office space, potential types of land uses, and then on the far right are more the industrial space and headquarters potentially, but they need different types of land in general. Business services and financial services have a real market advantage. Those business services are the largest employment area in Pinellas County among the target industries, and then financial services have the highest wage. So those are twin pillars, if you will. We always take a data-driven approach in how we do our planning, and we did a market analysis of all the industrial and employment needs in Pinellas County. And it's a little complex to read, but I'll just kind of point out on this slide that in terms of attracting more and supporting the target industry for Class A office space, we need about 500,000 to 1 million square feet of office space to accommodate the projected increase in jobs that we think will come to Pinellas County. And in the industrial area, we need about 1.4 million square feet to just replace obsolete space and meet those target industry needs. Pinellas has a lot of advantages, and one of those is that we have a really good jobs housing balance. What that means is that we've been a regional success in providing about one job for every working age resident in Pinellas County, and that has an enormous effect on transportation, on housing, and other issues. And it really means that we've got a competitive advantage by having workers that are nearby to the working needs of industry and employment in our county. Unlike you look at the chart on the far left, you've got Pasco County, Wakulla County. They export a lot of their workers to other counties because they don't have the jobs in those counties commensurate with their population. And then if you look at the far right, Orange County, Hillsborough County, they have to import workers from other counties because they have far more jobs than they have working age residents. In terms of economic impacts, the Tampa Bay Regional Planning Council partnered with us and provided some data. Again, it's kind of a complex chart, but what we really need is a mix of different types of land uses to support a thriving economy, and that includes housing. But it also looks at the range of different types of economic uses and the value they bring to the overall economy. And just quick overview of this chart, at the far right end, you can see the value added in terms of economic value overall. And you have financial services and business services far outpacing. But if you don't have the other components, they're not as effective. So we really need to think strategically about where to guide and support these target industries, and also encourage a greater mix of housing, jobs, and transportation options to support that. And that's really where it all kind of comes together. We also performed a land suitability analysis to look at where it's most appropriate for target industries to grow and thrive in Pinellas County. And as old story, we don't have a lot of vacant land, so we have to look at redevelopment and modernization of older building stock and looking at infill and replacement where we can. So we believe through this analysis that the target employment centers expansion is warranted, and we need to retain those target employment centers. So we've identified some new ones. The Gateway certainly is the biggest dog in the whole scheme of things because they have the most industrial and Class A office space in the Gateway area, and we did complete a couple of years ago the Gateway Area Master Plan that anticipated preserving and supporting that growth of office space and industrial, but it also anticipated increasingly mixed use and going vertical with more density in the Gateway area where appropriate. And the partners in that were Pinellas Park, St. Pete, unincorporated Pinellas County, and the city of Largo. And I was really happy to get the Florida Department of Transportation to also support the Gateway Master Plan and invest in that. And I think they understand the importance of it as well. Finally, urban centers of Clearwater and St. Petersburg will continue to be drivers for Class A office space, and that's primarily in the downtown areas, but it also could include the US 19 corridor, Countryside Mall, places like that as well. From the policy recommendation standpoint, in the TEALS update, we are recommending that we retain those target employment centers and expand where appropriate. Again, at the Ford Pinellas level, we enable local governments to take actions for these things. So it's up to the local governments to ultimately adopt target employment centers, and some of those boundaries for the new proposed target employment centers may change as they figure out exactly what that overlay looks like for each local government. We are moving away from the one-size-fits-all approach of just preserve land and instead allow for flexibility at the local government level to incorporate mixed use, higher density development, and really reflect the market needs of those employers. We've created subcategories in the target employment centers to enable that flexibility, and I think that that will go a long way towards our Advantage Pinellas plan in terms of housing and transportation strategy. Sure.
Before you go forward, I just want to make sure that I didn't mishear what I think I heard you say. When you started your presentation, and I know we've talked a lot about this on Forward Pinellas, but did you say that the target areas that you identified, that we made that decision 15 years ago?
Yes, 2008.
Well, okay, well, I mean, how do you know that hasn't changed from then until now?
It needs to change. That's been our assessment.
This plan is to get away from that.
Okay, well, I just wanted to make sure that I heard you correctly and that is exactly what we were talking about, because that really bothered me. Thank you so much.
Yeah, I think the global, state, and countywide economy has changed since 2008, and so we're trying to reflect those changes with this update of this project. So it's interesting, if you look at the map of where these target employment centers, what jumps out at you is these are on regional transportation corridors. And regional accessibility really matters to all of these, whether it's State Road 60 in downtown Clearwater, or the Countryside Mall, or in Oldsmar, where you've got the confluence of major roadways that serve 3 counties. So all of these depend on really good, accessible transportation networks. This is the implementation proposed policy, and you can see this is the subcategory areas that we created for the target employment centers. So we go all the way from tech urban, which is the most intense, think of downtown areas, all the way down to target employment center or tech local, which would be very flexible and subject to special area plans developed by the local government level. And think of like the Warehouse Arts District in St. Petersburg as being a really good example of the tech local. But for each of these, our recommendation is to increase the allowable density. The floor area ratio would increase. And in addition to that, you would give an incentive by not counting for the office space categories. You wouldn't count class office space towards that floor area ratio. So automatically that builds in a natural incentive. For the industrial areas, like the tech, suburban, industrial, you wouldn't count the manufacturing space or industrial space towards that allowable floor area ratio. And that really gives, for CEOs you were just talking about, that gives them enormous flexibility to think about what their business model should be and what their space needs are going to be. And we've heard a lot of talk about nobody's going to the office anymore and office space needs are declining. That's really not true. That's a simplistic approach to things. People do have a lot more flexibility, but employers and employees want to go to high quality office space in a mixed use environment. So think of Water Street in Tampa, think of West Shore in Tampa, places like that, and we want to be competitive in that market. So that's why downtown St. Petersburg in particular is thriving right now, because it offers that mixed use space for folks. But we like this approach because it gives all of our local governments flexibility regardless of size. So it's not just St. Pete and Clearwater, it's going to be Largo, Safety Harbor, and Oldsmar and places like that that can take advantage of these opportunities. So this is all wrapped up in a lot of different policies. First is small area planning. So we will be working with our partners at the local government level to guide them and support them if they want to establish tech local, for instance, and conduct a small area plan. It's not an onerous process. We're really just asking them to identify sort of the strategy and think about how that fits in with the infrastructure and services and compatibility with surrounding areas. The housing compact that you all have adopted and many of our local governments have adopted and the action plan associated with that all need to be intertwined with the target employment center and industrial land study, because we do see this mixed use opportunity being a place for a mix of income types for housing. And that would be consistent with the Live Local Act that just passed the Florida legislature and has been signed into law, and also previously House Bill 1339 and Senate Bill 962, which essentially did that preemption. We will be establishing a TEALS working group among local governments and employers and others who can help guide us as we continue to monitor conditions. And that's where we'll be working with Dr. Johnson and her CEO group to continue to provide periodic updates as warranted. And then this will also tie into strengthening our efforts for workforce development, where transportation comes into play, because people need access to jobs and they need access to job training. So our next steps, to wrap up, are we are well underway in bringing forward changes to the countywide plan and countywide rules based on the findings. That's already been presented to our board, and it will be presented for adoption in a public hearing on July 10th, I believe, at our next board meeting in July. That will then be transmitted to the county commission to be considered as the countywide planning authority for those changes. In the meantime, local governments will be able to begin working on their changes to their comprehensive plans to incorporate the TEALS update, and that'll take place in the fall. And this is really a foundation for us to develop our next Advantage Pinellas long-range transportation plan, which is underway and required to be adopted by October of 2024. And that plan goes out to 2050, but it is the basis for our 5-year work program established by the Florida Department of Transportation. And everything FDOT is doing right now in terms of establishing priorities and delivering transportation projects is focused on the land use context and the jobs context of what you're facing. So I think we're really set up really well to partner with FDOT and others to bring a lot of good transportation projects to Pinellas County that support this target employment effort. So I'll leave it there and open it up to any questions that you have. Thank you very much again for the opportunity to be here today. Sure. Thank you.
Next is our agenda briefing. Do we want to take 5 minutes before we
Sure.
move into it? Do you mind?
That's fine.
Let's take 5 minutes. We'll come right back. 5 minutes. finish our agenda briefing, please, Barry?
Yep. So just to highlight, Commissioners, before we get on to the other stuff, so that was the agenda for for today's workshop. Next workshop on June 8th, we'll have a legislative update. We'll have Brian and Southern Group here. We'll have the special districts, all the different special districts, libraries, Palm Harbor Community Services District, Feather Sound. We'll also provide an update on the activities for the unincorporated areas. So we'll have Nancy, Chris, and Brian give you kind of an update on the issues that they're dealing with for the unincorporated areas. And then we'll be talking, Tom will give you an update on the RV parks and mobile homes, which we've discussed in the past. So kind of an agenda coming up. We do have in the future things like state condo inspection program that we're going to have to talk about. Stormwater, we're doing a peer review, so we'll have that wrapped up. We're bringing that in about July. So several things kind of in the hopper coming up. So, all right, moving on to the agenda. We have National Historic Preservation Month proclamation, Memorial Day proclamation, National Public Works Week proclamation. Various items under receipt and file, clerk of courts, and things like that. The first regular agenda item is item number 12. This is the first amendment to a purchasing authorization with Duval Ford for vehicle and equipment replacement. Since this was originally signed in December of 21, costs have went up regarding vehicles, and so this modifies the agreement to account for the increased cost. Item 13 is the third amendment to an agreement with Robin Collier for Sprinkler-Matic fire protection systems. This is all of our routine safety testing, inspection, certification, repair for our fire systems throughout the county. Third amendment increases the contract by $250,000, and it gets us through the end of the contract term, which is the end of this year. You can see the increased pricing of 16.5%, but again, it's being bid out, and so this is to bring us to the end of the contract period with the increased cost, and then it'll be part of a bid process for the new contract. Just, yes, the end of this year. Item 14 is a resolution approving an updated list of code inspector job titles. But this is a statutory requirement that we define them. This is not just what you would think of as our code enforcement. It's people out in public works, urban forestry, transportation, environmental, and we have to specifically do that to be able to exempt their home addresses, telephone numbers, birth dates, and things like that from being public records. Okay. These are people that go into people's homes, and so by state law, they're allowed to be exempted. You have to approve that exemption annually.
Hey, Barry, just a question. On the previous one, actually the previous two, and it's just kind of a comment, as we head into budget time, I know there's going to be a lot of pressures on next year's budget. I'm hoping that we at least see some alternatives from you as it relates to business as usual versus maybe smoothing things out a little bit, pushing things back a little bit where we can. The purchase of automobiles for one. You know, here's what we would normally buy, but the costs have gone up, so we put more money in versus maybe downsizing the fleet this year just to try to make some accommodations somehow to these crazy price increases.
Where did Don go? If you would ask a second, we'd have our fleet manager here, but he stepped out. But Commissioner, that's exactly what we're talking about. We need to look at where we don't need vehicles. What I don't want to do is defer replacement of vehicles to where you have a pent-up cost. In other words, but where we can consolidate our fleet and have fewer vehicles, we're attempting to do that. And so we want to do that, but I don't want to, and have, if I buy 20 vehicles this year, each year, I don't want to have a backed up demand to where we have 40 vehicles next year, or we have increased maintenance cost. So where we can truly downsize, consolidate, we're trying to do that. But Joe, if you want to add to that.
Thanks, Barry. Joe Laurel from Administrative Services. We're actually looking at the underutilization of vehicles as well. So vehicles that aren't being used as much, we're going to get rid of them. Just that simple. We're doing that currently, but Barry hit the nail right on the head. It's the entire look at the fleet. Anywhere we could save money from a fleet perspective, we're certainly going to approach that, no question about it, Commissioner. So-
Yeah, well, I know that in some cases, when you put these cars that we get rid of out on the market, people look at them and say, God, these are great. You know, like, we could have had another year or two out of them. And I know there's a maintenance issue that we kind of balance off against the new purchases. It's not like roads that we defer, that we have to really up the cost of replacing a road. I just think we're going to have to figure out different ways of watching our cost increases, because I don't know how else we're going to keep control of these out of control prices
And I will tell you, departments are doing exactly that. They're looking at alternative ways of doing business, and we challenge that. And you're going to see that in some of the BIS meetings where we're challenging the way they do business. You're also, and you've seen that on some of the contracts. Some of these contracts we've put out for 6 months, 8 months, 9 months, while we kind of figure out what we can do. Because we're seeing 40% price increases, especially around chemicals and things like that. Now they're trying to say, okay, can we not use this chemical and do something else? So I think departments I think those are great discussions to ask the department directors as we go through these budget meetings. But like in the fleet, we do have a point factoring system that looks at maintenance, et cetera, and stuff. We try to rotate vehicles out to where high utilizers, we give them a vehicle and push that over to a department that's maybe a pool car or things like that. But simply going and saying, use your own vehicle and we'll pay you mileage versus having a vehicle here that we have to maintain and things like that. Where we can do all those things, we're attempting to do, and that is something that we discussed with our fleet manager here recently of doing, just pushing harder. There's certain departments where we have more influence over and certain ones that don't report to me. So, they have challenges a little bit with that, but we certainly are going to push harder on that.
I mean, it's a balance. I know we're trying to keep costs under control for our residents, and taxes and all that we pass through. Trying to get a hold of that at the expense of maybe a little less service or a little less, and so it's a tough one. It's a tough one to balance, but I think that's the kind of conversation we need to have.
Tom mentioned to me yesterday, he's like, we're not going to be buying 150s. Let's go to something that's less cost and are more available because, more fuel efficient, things like that. So they are looking at those things.
Thank you.
On number 13, Barry, the unanticipated repairs, is that something that was a result of the contractor? On item number 13.
I wanted you to answer this.
Yeah.
I apologize, I didn't hear the question.
On item number 13, the unanticipated repairs that are mentioned, was that due to the contractor, or was that just a natural thing that happened?
Or a fire suppression system?
Yeah, no, it's a natural thing, Commissioner. A lot of our buildings are getting older, and when it comes right down to it, pipes are broken, as an example, and that in itself is a pretty expensive repair, and we found several issues with that throughout the year. So yes, that's a major part of that expense.
Okay, thank you.
Item number 15, are we good on the other ones? Okay, item 15 is a resolution approving ad valorem tax exemptions for 4 historic properties in the city of St. Petersburg, and they're listed within your packet, and they qualify under the guidelines. Item 16 is behavioral health receiving system plan. This is to support and facilitate the receiving system and mental health substance abuse, and this is like their transportation plan. And so if you have questions, I can bring Lourdes up.
I have questions.
Lourdes, please. Or Karen.
Do you have a question? I do. Okay. Commissioner Peters?
Thank you. So I know this is kind of the same rehashed plan that they've been doing since statutorily they were required to do it. But what is missing is anything that we're doing on CAM. What's missing is Pinellas Matters. None of that is in this report. Pinellas County isn't even listed as a partner. And I know we don't write it, and we're not part of writing it, but the Pinellas Matters and the CAM are not included.
Lourdes Benedict, Assistant County Administrator. So the Acute Care Committee, which is overseen by, and I know you know this, Commissioner, by Central Florida Behavioral Health Network, has lots of partners, including us. Dr. Joshua Barnett is our person and actually made lots of changes to it and input, but those two things are not on there. The CAM's not, we didn't want to put it in there yet. It's not done. We could make mention of it. And it is a transportation and receiving plan, but there has been updates to it, and I can send that to you of what the updates were from it. It's not really rehashed. It's come a long way.
Okay, I mean, I perused it, I didn't read it, I just perused it, but I was surprised to see Pinellas Matters not in there, and I was just surprised not to see the CAM, because this is a plan. It's not about what we're doing right now, it's about the plan. And so I was just surprised, so I'm just making a comment that I'm surprised it's not in there. I guess that's it.
We can certainly add that. What happens now is after you all approve it, it goes then to the Secretary of DCF for approval.
Yes.
We still have, a minute if we wanted to add some language to that.
I mean, my thought is, I'm not sure why it wasn't added, only because it's a plan. It's not telling us, future projections should be in a plan. And Pinellas Matters certainly is current when we have future projections for that. So I just was surprised, and I don't know if the rest of the board thinks it should be included. If it's Pinellas County's plan for a central receiving system, and the CAM is pretty much a central receiving system, much more than what we've had before, I'm just surprised it's not in there.
We could have language ready for you on Tuesday if you would like us to prepare recommendations on how to include that.
That's a good idea. Let's do that.
Do that.
Does everyone else, I
Yeah,
if
think
you all
that's fine.
agree.
Yeah.
Okay.
Thank you. And that's really making acknowledgement that the county is kind of taking the lead on the central receiving system. And
Yeah, and it's on its way. It's coming. That kind of thing.
Yeah.
And it's some reference to it, even though it's not ready to go yet.
That's a good point. I think we should
Yeah.
add it in there.
It's a great idea.
We'll prepare some draft language, and you can look at it, and we'll send it out in advance before Tuesday.
Thank you.
Okay.
Great.
Thanks.
Thank you.
Item 17 is a Resilient Florida grant agreement with Florida Department of Environmental Protection for reliability improvements at 4 county utility department facilities. So this is a $3.4 million grant and will improve hardening and wind vulnerability at the 4 facilities that are listed. Item 18 is an extension of Career Source agreement. County Attorney's report, County Administrator's report, and then we have reappointments to the council for persons with disabilities. These are individual appointments by Commissioners Flowers, LaValla, and Long. One's a reappointment, 2
I
new
have
appointments.
one addition. I didn't get it into Della in time, but we'll also be adding my appointment to the Disabilities Council. We'll just be adding that one on.
Okay.
Thank you.
We have County Commission new business updates. We do have public hearings. We have 2. The first one is declaring a portion of county-owned property as public right-of-way, declaring a separate portion as surplus, and grant authorization. This is a joint agreement with the City of Largo, and this will allow for them to build a new fire station, and this will cover the Dansville area, and then we'll take over the land, so it's a land swap as part of that. I will tell you that as part of that, 6 of the 8 neighboring property owners are okay with the location, but there are 2 that are concerned about a fire station being located there, but they've been working on this for a very long time. So I can certainly answer any questions, but it's a land swap with City of Largo for fire protection in that area.
What are the residents' concerns there? Just noise or?
Yeah, a fire station's located in their neighborhood. Yeah, so. But it's a built-out area, so, land's hard to find. And then the second one is the resolution or ordinance adopting the North Greenwood Community redevelopment area and creating the redevelopment trust fund for a 20-year period and establishing the county's tax increment contribution rates that we've talked about before. That's it.
I don't mind making it here, but I wanted to do the one related to Career Source at the dais because we have a lot of updates on that, and I want to make sure the public knows what's going on. So,
Thank you. I really wasn't expecting to give my report today. And I was feverishly looking at my calendar to see what all I've been doing since we last met.
Do it Tuesday.
The agency area of aging lunch was this week. That was very much a success. I know several of us were there. And I enjoyed our meeting last week. I know that was very important to you. Wonderful view at TIA. But I think in the future, we should make them come to Pinellas County. We should.
That was not my idea.
But I don't have anything new to report.
Okay, Commissioner Eggers.
Yeah, I'll probably have a few comments on Tuesday. But one of the things, and I was going to bring it up today, just not to really get into discussion, but I was planning to move in a direction, and then I know we've had some changes at the utility department, but I've been getting a few detailed utility statements from residents in unincorporated Palm Harbor talking about their reclaimed water charges. And then of course, I got a couple from cities to look at it, and I know we're in the process of making changes up in the reclaimed area where we're going to introduce meters, and so that's a good thing, and I think it tightens up the system and monitors usage, and I just want to make sure that whole discussion will be brought to bear, because right now they have a reclaimed water availability charge, has nothing to do with how much they use. And it's pretty high. It's higher than their water charge. So when we get a meter put in that's going to charge them on consumption, I'm assuming that the availability charge will go to zero or low, not zero, but low, and that they get charged based on the consumption, so that we can govern the amount that they use and charge them a premium if they go over a certain minimum amount. I don't want to get into the discussion today, but it is hopeful that when I look at my own reclaimed water charges, they're about 25% of my water charges, which is the way it was initially structured and supposed to be that way. So I just want to make sure that we're taking all that into account when we start to develop that new rate structure for reclaimed usage in our county.
Joe, when are we going to be bringing in the rate study this summer? So we're going to be bringing in the rate study, the way in which you charge, via, just to maintain the system regardless of whether any usage is there or not, and versus that's all part of that discussion. And so we can look at those structures, and there's different thoughts and different recommendations on that.
Understand. I just think the basic premise of the charge that we have now should encourage usage of the reclaimed versus what it looks like it's encouraging, the way it's structured now, and if it stays that way, to use more potable water than reclaimed water. So I'm hoping that we have that robust discussion as it relates to our new reclaimed water rates when there is a,
I could answer some of
Yeah.
it, but we'd have to get into it all because it's all based upon that. They are recommending a change in that structure to where it is, there's an incentive for consumption. But again, if you're okay, let's do it.
That's fine.
It's
That's
coming
fine.
in within the next couple months.
that's fine. I just want to make sure those discussions are had.
And Jill's taking notes, so.
Thank you.
Okay, is that it?
Yeah, I'll have some stuff for Monday, or Tuesday. I'm not gonna-
Okay, no problem. Commissioner Peters?
The only thing I would report on is our trip to Miami. Karen and Lourdes went with me and Nick to see the new CSU that Miami is opening. It's a 208-bed CSU, 7 stories. It's quite the facility. They will be, it will be, CSU, Marchman Act eventually, maybe, and residential treatment. They may even make it some transitional beds. So it's very interesting what they're doing, and they're making it a one-stop shop for, like we have our FQHC for healthcare over by the homeless. They will have, it's not an FQHC, but they'll have podiatry, optometry, traditional health, dental, all kinds of things at this facility. And it's different how they manage their frequent flyers, their high utilizers of the system, because they are not doing mental health court. And the judge does not believe in mental health court. It was interesting to hear his comments. They're doing diversion court, and diversion court allows them to really work with more of the people with severe mental illness. And through his diversion court system and some policies some legislation I helped get through back in the day, allows the court system to ensure that these people with severe mental illness get greater access to care. And so it's interesting, the model that they're using. They have many more peers than we do because the rules and regulations for peer counselors is different through the court system than it is through DCF. So, it's enough to make me want to go back to the legislature just to make some more changes for regular communities to be more successful, but I really don't want to go back there. But anyways, it was a wonderful opportunity for me to see it again. We did learn a lot about their CIT program, where their CIT program is very comprehensive. And I think because of that comprehensive, they have greater success. And anyway, so it was interesting. We got a couple nuggets that we walked away from. Interesting, the new medications that are coming out, the long-term injectables now, there are some that will last up to 6 months. And that's a breakthrough. If someone with severe mental illness and schizophrenia can have medication, one shot, and it lasts 6 months, that gives them time to get stabilized, back in housing, back in jobs. I mean, it's game changer, real game changer. So it was a real interesting tour. We learned a lot, and I'm interested to see how it works when it's operational. Like, they get the CO hopefully next week, they said, but they probably won't have patients in there for 6 months. But it's very interesting.
Is that it? Yes. Commissioner Scott?
Thank you, Madam Chair. Just a couple of things. I'll have a more detailed thing on Tuesday of recent activities. But Commissioner Eggers, I'm glad you brought up the reclaimed water, because I've gotten feedback on that exact same thing as well. So thanks for bringing that up. One thing I think that we should consider maybe bringing back for discussion is the marijuana dispensaries variances that's been delegated over to the Board of Appeals and Adjustments. I think that's one that we need to consider bringing back here and having that authority brought back under the Board of County Commissioners. So I would like to see if we could bring that back for further discussion on that one there.
Yeah.
I've gotten a lot of feedback from the school that we know that was impacted by that. And while that's kind of water on the bridge at this point, I think going forward, I think that's authority that should really rest with this body. So that, and seeing is that we're only 2 weeks away from hurricane season, as a new commissioner, never gone through hurricane season before. Is there anything that we need to do as far as commissioners, as far as training or anything, or is there any responsibilities that we have as commissioners that we need to be aware of? in a pair of waders and, no? I know, just the thought.
Yeah, rather than waste time here, when I do my one-on-ones, we can kind of walk through some of that.
Commissioner, is that it, Commissioner Scott? Yeah? Commissioner Flowers?
Thank you, Madam Chair. As I shared, I'll just share out what occurred at our Career Source Board meeting on yesterday, so that everybody will be brought up to speed about what's going on with the, I don't want to say merger, but the consolidation. So I want to bring everybody up to speed on that one. And my last T-Barter meeting will be on the 26th. So that'll be it when we kind of get everything out and closed up. So I'll share that. And then I'll also just share with the PSTA Planning Committee some of the thoughts going forward as it relates to providing free bus service to veterans and where we're going with that and some of the costs associated with that. And I will be distributing to each of you the final toolkit from the National Association of Counties Housing Task Force that I was appointed to. We had our last group meeting in Dallas, and we tried to clean up some of the pieces within that. And this toolkit is really just that, a toolkit, because communities are different. So you get to kind of tweak it how it best works for your community, but it's broad enough where it does take into account all of the issues that are going on with housing throughout the United States. So I will email that to each one of you, and hopefully you will have a chance to peruse it. And if you have any suggestions or comments, please share them, because we'll have our final wrap-up meeting at the NACO conference. And I'd love to be able to share some of that, whatever your suggestions are at the NACO conference. And
when is that?
The NACO conference is in July. It's in July, the 20th, 21st, the 20th through the 24th.
Okay.
In Austin, Texas. And that's all that I have.
Okay. Well, I have lots to report, and I think for the good of the order, I'll just defer everything until Tuesday, because who knows what's going to happen with some of this. Oh, I am out of town. Oh.
You might want to do it now.
This is a problem.
All right.
Okay, well, I'll try to be brief. Are you going to talk on Tuesday, Brian, about the Forward Pinellas? Are you on Forward Pinellas? Yeah. I can. David, between the two of you? Yep. Okay, good. Then I won't repeat everything. We had our TDC meeting yesterday. There's a lot of stuff going on there. I do think it's important to share, though, that Mayor Oxt, who is not going to be available on Tuesday, so I'm letting you know that now, because he was specifically interested in item 23 on our agenda, which he is very in favor of. But he noted that he had a meeting last night. He was having a meeting last evening about the scope of the Phillies' ask, and that it was going to be much more than their initial $40 million. So I'm assuming that we'll hear more about that as we go forward. Barry?
I'm sure I will.
Yeah. The Dali, I found the comments really informative, because they had an expansion plan that included a very large parking lot, which they have totally eliminated because of the new Sunrunner line and how successful that is. And between the Dali and the Mahaffey and the Rowdies, they decided that they would take their expansion and focus on programmatic needs that they had. And so there was a huge discussion about all of that. But that was approved to recommend to the TDC that will come here, I don't know, whenever that's appropriate.
So Commissioner, I think most of you have visited the Dolly, and seen what they're, heard about what their expansion plans are. Staff was making a recommendation. The TDC went above that and recommended the full amount of the ask. And so it will then come as a staff recommendation back to you, along with the TDC recommendation from their discussion yesterday. I haven't worked with staff yet, but it'll be coming within the next couple months.
And we're having our next TDC meeting at the Dali, so that'll be informative for some of those board members as well. There was a lot of discussion from the different departments that were reporting, because yesterday was all about their budget. And the overall theme from their SWOT analysis from each department was that competition from other markets is ramping up, and inflation from the Russia-Ukraine conflict is making it harder for people to afford to travel here from Europe and the Scandinavian countries. So there's developing interest in niche markets here, and getting more creative with advertising will be critical to keep the interest here in Florida. Another concern is the fact that the Bright Line train, which I've been talking about a lot, will not connect to this area right now, and lack of transportation to get people from the end of the train in Tampa over this side of the bay will negatively impact tourism and European interests. The TDC folks feel that they will decide to go to Orlando, West Palm, or Miami instead. And I will be leaving, thank you for reminding me, Commissioner Peters, tomorrow for San Antonio for the world's largest trade show here in the United States. And so Commissioner Peters will be chairing your meeting on Tuesday. I was excited to finally have the Tri-County meeting that we had over at the Sky Tower 1 last week. But I was terribly disappointed in the lack of substance for the agenda, and I'm very much looking forward to how we move forward to have the next one, which there seemed to be great interest in pursuing that. Have you had any follow-up since then, Barry? About
Trying to get the meeting with the other county administrators to discuss it. It was very intentional because we have 19 elected officials to work with. Not everybody is on the same page in terms of topics you want to discuss. And it's very, very important for you to build relationships before you take on tough topics. Very important. Otherwise, you probably won't have a second meeting. And so I really want to make sure we look about the long-term effectiveness of bringing this group together. So I've asked for that meeting. I'm wanting to move a little quicker than they are. But we're going to try to get that scheduled in the next couple months to plan.
The reason it's important to me is I think you all know from being here for a while now that there's a lot of conversation going on regionally about a regional MPO. And there are a couple of groups that are very willing and ready to start working on a study to be able to come back and share with us next steps. I had been hopeful that Whit would continue to move that forward, but he has indicated there's so much on his plate right now that he's not able to do that for a couple of years. And that, to me, is just nuts with all of the issues we have surrounding public transportation in our region. And so I would like to have those conversations sooner rather than later.
I just think it's very important when you have a regional group like this that we all agree on the topics. And, you know, it's almost like a veto power because on that particular topic, there were certain people that did not want this to be part of that agenda. And so
I only heard one person that was opposed to it.
At that meeting.
Yeah.
Okay.
Well, you like to think people are coming to the table as honest brokers.
We met individually with all commissioners and we discussed these exact items. And so, you know, I think there's a process to get to that, and we need to all agree on the topics we're going to talk about regionally. I think that's a separate discussion. Now we can maybe put it on for a future. That's the reason I want to talk to the others. but it wasn't a good topic for this first meeting.
I get that. My question is, can we move the agenda along because there's opportunities to work on design and environmental impacts now?
I understand. If I can get the others to agree to meet with me, yes. But they've indicated it's going to be, they're telling me August before I can even talk to them. I've asked for this meeting to be sooner, but I can't make them meet with me.
Okay. Then, that's the end of my report.
I got something to
Yeah, can I?
Yeah.
So from that meeting, I at the end brought up the opiate thing, and I had someone from Hillsborough County and someone from Pasco County come up to me and ask if they could meet with me to discuss the opiates, because they're going to get some money to spend, and I don't know what all they're doing, but, so we have a meeting on the 7th with Commissioner and county administrators from Pasco and Citrus have been interested, and Karen and Lourdes are going to join me on a Teams meeting to discuss it. And so that meeting facilitated something like that, which doesn't mean we're doing a big, thing, but at least it's got us talking. And so I think there was value. I really think there was a lot of value in that meeting. And I think this is kind of like a first step on why that meeting was successful. And so it's not getting to the crux of what you're looking and hoping for, I know that, but when it comes to baby steps, I think this was a great meeting, and I think great things can come out of this meeting, even though it might be baby steps.
And I agree with what you just said, and to that point, there are some of us here that already have good relationships with commissioners in Pasco and in Hillsborough. So why can't we work from our end to kind of, push the pedal a little bit?
I'm willing to meet anytime, okay? But I have to have willing partners.
Yeah, I get it. Yes, Commissioner Lotto.
I just wanted to add, along with Barry and Commissioner Peters, I thought the meeting was a success. And I think it's important to note that the longest-serving county commissioner in the Bay Area, who I believe it's Ken Hagan, but he mentioned at the end of the meeting that, number one, he had never remembered the three counties meeting together, and number two, the agenda was purposeful, because it's no use having an introductory meeting where we're all yelling at each other and then never meeting again after that. So I think it's good for relationship, building and, for future meetings down the road. And nothing's preventing any county commissioner from calling another county commissioner from Pasco or Hillsborough or whatever.
I agree. I didn't say I didn't think it was a good meeting.
And it would be a good opportunity even at NACO. I think there's at least 3 of us going, based on what people have said, that during NACO we kind of hook up and talk a little more with each other's commissioners.
Right, and we have FAC in June.
And
Right.
back in June, right?
And we'll be at both, and that's why I asked Della to follow up on it, to see if Bonnie and Mike are going to be at FCCMA, which is in a couple weeks. So that might be an opportunity where I can advance this quicker.
There you go.
No, I'm already trying those, but
Okay, I was just
I've
asking
got
for an
to,
update.
I've got to
Pizu,
get them.
pizu.
Well, and Mike's a brand new county administrator. He's engulfed in the budget right now, and so it's hard to get on people's schedules right now.
As we all are, yeah.
know.
I know. I was just asking. Jeez. You guys are a tough group today. All right, do we have anything else? Anybody?
About the charter review appointments?
Oh, the bridge lighting. Oh, my God, how could I forget that?
I was hoping
Okay,
you'd forget
yeah.
it.
So listen, how about this? I have an idea. Imagine that. So you all got a copy of the resolution from Manatee, and I would like to know, considering the number of requests that we have gotten for new lightings, if we might be so inclined, you may remember in the past, I have asked for a discussion about what the public purpose is, because now that we have never said no, and it's just kind of a thing. Everybody in the world is wanting to light the bridge, and how about we just designate the authority to the county administrator and let him take care of it?
But I think if you, I mean, I don't think we can start telling people no now, especially if it's for a legitimate
rest my
public
case,
purpose.
but we have-
Like the one, I think in our emails had to do with lighting it red for firefighters, like, you know,
Right.
stuff like that. And so, I mean, I don't know if the county administrator wants to have to deal with all of those requests when
Not really.
he has a lot of stuff on his plate. So I mean, I don't mind us having a discussion every meeting about lighting the bridge, because I think Barry has other stuff he has to do.
Yeah.
David?
Yeah, I kind of agree with Commissioner Latvala that I think we did take a step not too long ago, maybe I'm just wishful thinking, but where we had a list that we've approved.
Pre-approved.
And that list will just be moved forward for a standard approval, and that will add ones to that list. So hopefully in time, there'll be,
It'll be everybody.
it'll be somewhat
Seriously.
somewhat control over it. I do think it serves a public purpose, because if those folks that are asking for it can take pictures of it while it's up, then they can use that in any of their marketing pieces, any of their ways to communicate with the residents about what they're doing. So I think it's a big deal. Not that I can remember the last one I've actually seen myself, except in picture form. But I think it's great, and I'd just like to keep that with us here.
Okay. Okay. Ryan?
Thanks, Madam Chair. Can we just put it on the consent agenda? I mean, does it have to be a separate item?
That's a good idea, too.
You know, I mean, in a way, if somebody wants to pull it, we can pull it and talk about it, but, so.
Can we do that? That's a great idea, Brian. Thank you. There you go. Yes, Commissioner Flowers.
Anyone who may not have decided maybe to go to the Florida Association of Counties conference, it's going to be two wonderful speakers. Mark Noosh, he was a Green Beret. He's going to share his declassified story about some of the things that he's done going behind the scenes after 9/11. His book is Swords of Lightning, so I think he's going to be really, really good. And he's the closing session, which will be on Friday. And then Jeb Bush is doing the opening session on Wednesday.
Oh, that should be
So
interesting.
if that will maybe push the consideration for others to attend, I think those will be two very interesting sessions.
We usually have good attendance, but it's at a different place this year, right?
Hilton Bonnet Creek.
Yeah. Okay. That's it? Anything else? No? Thank you. I'll tell you all about it when I get back. Thank you, everybody.